Hello, everyone, and welcome to our World Diabetes Day webinar. My name is Tammy Amoye. I am the Director of Advocacy and Organizing here at Patients for Affordable Drugs. Thank you so much for spending your Thursday afternoon with us. We are so glad to have you all here with us. For those of you who are joining us for the first time or learning about this for the first time, we are Patients for Affordable Drugs. We're the only national patient advocacy organization focused exclusively on policies to lower drug prices. And we are collaborating today with T1 International's DC Insulin for All chapter. T1 International is a patient-led advocacy organization that works to make essential diabetes supplies, especially insulin, affordable and accessible to everyone with type 1 diabetes worldwide. Like I said earlier, today we are here to celebrate the World Diabetes Day and to talk about the real progress that we've made towards lowering drug prices and expanding access. 3 years ago, something really cool happened. The 2022 prescription drug pricing law gave Medicare the power to negotiate lower prices on some of the most expensive drugs, including insulin fios, Jardiance, and some of the GLP-1s. And starting January 1st, 2026, the first 10 negotiated prices will finally go into effect, bringing relief to millions of patients who have waited too long for change. But while we are celebrating this incredible milestone, we know that there's so much more work to be done. That's why we're here today to talk about what these policies mean for us in real life, especially through the experiences of patients who are living with diabetes and other chronic conditions. So, to help guide today's conversation, I am excited to introduce our moderator, Emma Bella Rod. She is a Washington, D.C. based T1 International Insulin for All and P4AD advocate living with type 1 diabetes since the age of 5. I will pass it on to Emma Bella. Take it away.
Thanks, Tammy. Hi, everybody. I'm really honored to moderate this conversation on World Diabetes Day. As people living with diabetes, this is what we look forward to every year to just talk a little bit more about what it's like to live with diabetes. And so, to talk just a little bit about my experience, I've lived with type 1 diabetes for 19 years and became involved with T1 International and Patients for Affordable Drugs as a patient advocate because currently 1 in 3 people as of 2024 are rationing their insulin. And choosing between insulin and the cost of living is a failure of our system. Right now, I'm currently involved, like I said, as an advocate with P4AD and also T1 International's DC chapter co-lead. So very excited to be here today to talk with fellow patients. And we'll talk a little bit more about if you're interested in becoming involved with us. We'll talk a little bit more about that later. But today, I'm really excited to be joined by 3 incredible advocates whose lived experiences show what policies like Medicare negotiation and patent reform could mean in real life. We're excited to welcome Erilyn McCullough, and she'll be joining us here shortly. She's from Oak Park, Michigan, is a P4AD advocate, retired U.S. Postal Service worker, and liver transplant survivor living with diabetes who has firsthand experience navigating the high cost of Ozempic, one of the drugs selected for Medicare negotiation. So she should be joining us shortly. And then we also have Lena Mubeye from Washington, D.C. She is a T1 International advocate living with type 1 diabetes and a children's book author whose work centers around emotional storytelling, diabetes advocacy, and children wellness, and will be speaking on the impact of drug patents. And then finally, we have Kay Peterson from Lebanon, Kentucky. She is a P4AD advocate and retired librarian living with T1D since 1983, whose story centers on the price of insulin and her medication called Fiasp, which is another drug up for Medicare negotiations. So very excited. Thank you all so much for being here to have this really productive conversation surrounding World Diabetes Day and what reform can look like for us as patients. So I'm going to come to Lena, and we just want to talk a little bit about patents. And, for those of you all who don't necessarily are familiar with the patent process, this is what we see really driving the high cost of drug prices in the United States. And so we're going to talk about something called patent thickets. And what this is we're talking about drug companies actually filing layers of overlapping patents to block competition and keep prices high long after they should have been dropped. So to Lena, as somebody managing diabetes as a young adult, how do you see these patent practices affecting your access to care? When you hear about companies filing hundreds of patents to extend their monopolies, what goes through your mind?
Hi everyone. As a young adult living with type 1 diabetes, these patent practices don't feel abstract. They really do hit my life directly. So when companies file hundreds of patents to extend monopolies, it keeps prices high and keeps competition low. So for someone like me, that translates to fear and instability around something I need every single day to stay alive. And so there have been moments where, for example, a sudden job change or shifts in policies forced me to immediately figure out, how I was going to afford insulin. I've, rushed into Medicare before just to stay safe and have that as a backup option, even while having, another medical insurance. So when people talk about patent strategies, I hear, okay, am I going to be okay next month? And so that's really the emotional reality behind these kind of decisions.
Thank you, Lena, for sharing. I really appreciate you sharing your experience, and it's it's not out of touch for a lot of what Americans experience, even beyond what us as type ones experience. People every day are making decisions based on what they can afford, and it's unacceptable that we have to go through this, especially given that 100 years ago the patent was filed for $1 by the inventors of insulin. And so really appreciate you sharing your story and advocating on behalf of all of us. And in regards to, beyond patent reform, we're seeing, state legislation, federal legislation, trying to protect the rights of patients to just be able to survive, right? What kind of reform do you think would actually make a difference for patients like you on a larger scale?
So I think that for me, real reform is honestly pretty simple, just making insulin genuinely accessible. And so a few things make an immediate difference. And so an actual national cap on insulin prices, one that helps people, even if they don't have certain types of insurance. Diabetes doesn't discriminate. We all know that. And so affordability shouldn't either. Also, transparency around pricing. Patients deserve to understand why something so essential is still so expensive. I feel that, and I know that, just by being a diabetic, that when we talk about pricing for insulin, there's never just a straightforward answer. And so transparency about pricing, and then also faster approval for biosimilars. So that way we're not just limited to one or two high priced options. And then also finally emergency access laws so that no one is rationing or panicking about affording their medication.
Absolutely. Thank you so much, Lena. I think all those policies that you covered would extremely help patients, and we're seeing states implement these, but really what we need is, on the federal level to ensure these protections for all people. And so really appreciate you touching on those points. Um, Thank you. I'm going to hop over to Kay. Kay, for years, you've been speaking out about crushing cost of insulin. And now that Medicare can negotiate lower prices and insulin fiasp is on that list, and we're seeing, the official Medicare negotiations come into practice early next year. What does this milestone mean to you personally?
It means a great deal, especially for me, 68 years old and on Medicare. Um, that there's a free and open market now that we can discuss and give our points of view about prices and give it on a personal level. Diabetes is not a one size fits all condition. One insulin might work for one person, but it uh, not be effective for another. Uh, in Kentucky, here we have capped the price of insulin to $35. That is a big help to me, and especially for FIASP, because the last I checked, three vials were going to cost me $700 a month. That I live in assisted living, and that's just unimaginable, unthinkable. Yet people are, and even on Medicare, are scrounging to even afford the $35. So we're looking for, and with insurance companies, I have been shopping for a Medicare Advantage program. Uh, Last year I was on Humalog, but the Medicare Advantage supplement I'm looking at does not cover Humalog, but it does cover FIAS. So uh, you've got to work with the insurance companies, and you've got prior authorizations, uh, just a lot of hassle. And for seniors and disabled, uh, it's it's just another a brick in the wall. But we need fair and equitable. I don't mind paying my fair share, but don't don't make the system so that we can't afford it. And there's a delay, deny, and I say, well, the third one just might be death. And I just can't have that. It's just unacceptable.
Absolutely. Thank you, Kay. I think you addressed a really great point in regards to navigating the insurance system. I think living with, an autoimmune disease like type 1, it's already so hard day to day to navigate the normal things we as people want to do. And then at the same time, also jump through so many hoops to make just, the things we need to survive like affordable to us. And so the time and investment that we have to make into these, into these decisions, like it is exhausting and tasking. I guess my next question for you would be, what would you say to lawmakers and key players in the arena who like still question whether Medicare should have their power to negotiate? What would you say to those individuals who are questioning whether this legislation should be exist?
Well, the first thing I do is say some, we've got to have a governing body. And we've got to be able to change and adapt to the times. When one insulin comes out, it's like a new car. When you drive a new car off the lot, there's going to be another to replace it. We need more stringent regulations, but not so that it hinders the patient. It needs to be patient centered. And with the advent of artificial intelligence and things coming down the pike, uh, it's like I tell people, the illustration I give people is uh, in six months ago, there was a conference on women's health, but the panelists and the participants in the discussion for women's health were all men. Now, uh, if you're going to have a discussion on prices, especially for insulin or any other drug that's heart medication, and we'll go for insulin, you got to talk to the people that it matters most, the diabetics, the family of diabetics, because when if there's one diabetic in the family, and with my family of 8, there were 3. I mean, 8 kids on a farmer's salary. You got to talk. You got to go to the grassroots and talk and listen.
Absolutely. And I think, it's a testament to what Lena, you and also Kay are doing is, making your voices heard. And so it's so important as like advocates that, we show that, we are constituents and that these lawmakers, that are on the Hill are elected to represent us, right? And they should be listening to patients like us because, we elected them to be our representatives there, right?
Yes,
Now,
ma'am. And all I'm asking for is a seat at the table.
absolutely. And we all deserve it, right? In this democracy, we all deserve that. And so it's so important that, grassroots advocacy starts here, but, following up with your legislators and sending, emails and mail and calling and reinforcing and that, we need this to survive. And so we'll get into our call to action later, but I agree, Kay, we deserve a seat at the table. Now, another question for you. The Inflation Reduction Act was passed, in 2022, and now officially these lower prices are going into effect as of January. As a patient, how does that make you feel? What do you think the impact will be, not only for people with diabetes, but across the board?
It well, it gives people a chance to afford life-saving insulin. It gives people a chance to live. They don't have to wake up every day saying, "Well, this is the day that I die," or whatever. And we've got to stop. We've got to stop the rationing. We've got to stop. Uh, we've got to make, especially insulin for all. And like I said, we've got to have a seat at the table. And whether it's a Zoom meeting or AI or telehealth, or we've got to embrace change for the better, not to make our lives worse. So we've got to uh, pull up our bootstraps, or pull out our syringes, and just show legislators. I'm not afraid to show my insulin pump and my CGM uh, to anybody. It's like, or I said one day, I just wish it would go off during a meeting like that, so I could say, "Oops," you know, and look at and kids and seniors. Uh, I don't want. I don't, how many people does it take to die before we get some legislation passed? I'll get off my soapbox now.
No, thank you, Kay. I appreciate you, yeah, speaking to that. I think a lot of patients will be impacted in a great way, but I think it's also yeah, worth mentioning too that these individuals on Medicare will be impacted, and that's incredible. So what can we move forward for people who aren't on Medicare yet, right? And so I think, Lena, to you, what would you like your lawmakers to know in regards to the patient experience, and why they should expand these provisions to all individuals, whether that's through patent reform, or a copay cap, or capping insulin for all people, commercial insurance or not. What would you want your lawmakers to know?
Honestly, for me, it's about just understanding that diabetes really is a full-time job. It's the carb counting, it's the constant checking, it's the injections, it's the emotional weight of what it puts on us. It's the quiet fear, it's the planning. It's really the resilience that it takes to keep going every day with something that never gives you a break. And so when we talk about, patience, patents, or pricing, we're not just talking about paperwork or policy. We're really just talking about real people, real families, real futures. And for me, it's just about giving us a fair chance to live fully without, these barriers that are placed in front of medicine that keeps us alive. Like you said, that was created over 100 years ago, and so much has changed since then. And just lowering the, again, like the barriers that are put in place for us to obtain it.
Absolutely. Thank you. And, to Lena and Kay, to both of you, you've been very engaged advocates, for quite a long time. I feel like I've known you all for many years now. And, what kind of advice would you give to, those who are watching that may be exploring the idea of becoming an advocate, or who want to become more involved? What advice would you give them? And you maybe could talk a little bit more about how, you all came into these movements, and what your story was to get here. I would love to hear. We can start with you, Kay.
Well, uh, I've been a person with diabetes for 42 or 3 years, but I've had a lived experience of diabetes for almost 60. My two brothers were diagnosed type 1, one in 1966 and one in 1970. Since then, I've seen a lot of changes, from my mother wringing urine out of their diapers to do the Clinitest urine test, to insulin pumps, to CGMs, now stem cell research. But we are alike, but we are each unique. I find diabetes is really prevalent around here via the gene pool or whatever. And I fight for the young mother who has to every year fill out an IEP or a 504, and the school board are saying, well, we can't monitor him 24/7. Well, they've got a nurse on staff. Don't For new parents and those just getting started, don't be afraid to tell your story. And you can recite facts and figures all day, like there's 500,000 diabetics in the state of Kentucky that we know of. But your story matters. Your voice matters. And we get enough voices. I mean, I'm an old redneck from central Kentucky. You get a lot of mad mamas on there, you're going to make a difference. So don't be afraid to tell your story and fight.
Thank you, Kay. Absolutely. I think that's great advice and really appreciate you sharing that with your many years of experience of being an advocate for our community. So thank you.
Thank you.
Lena, I asked the same question to you if you'd like to share and talk a little bit about your advocacy as well with, I know your children's book is incredible, so I'd love to hear a little bit more about that and what inspired you to write that.
Sure. I really love what Kay said about not being afraid to tell your story. So I've been a type 1 diabetic for 21 years now. I was diagnosed when I was 10 years old. And so for me, in my culture, it's really not, it's kind of taboo to speak about your pain and, your struggles that you go through out loud. And so I always felt like I wanted to be a part of a community where there were other individuals who understood what I was going through. Because we talk about, when we talk about insulin prices and lowering insulin prices, that what people have to understand is that's like a very small part of it. And as diabetics, we can all understand that because it really is just the everyday emotional weight that comes with being a diabetic. And so I really wanted to find other individuals just like me. Funny enough, I actually was diagnosed with a childhood friend. We actually were in the hospital together for, I believe it was about a month together. We were both diabetics. It's a funny story, but she was my first sense of community, so I was able to have her through that process. But when I moved away, I didn't really have anyone, that was able to go through that experience with me. And so as I grew older and social media expanded, I was like, I want to actually find a community of people like me and to tell my story and what it feels like to go through this experience as a type 1. And so anyone who wants to get into advocacy, just being open to meeting other individuals like you. And for me, I like to think about the younger kids who may feel fearful of how diabetes can stop them from fulfilling their dreams and just the burden that it is. Because sometimes I have these quiet retreats where I feel like, I feel like I can't show up and advocate the way that I really want to because of whatever is going on with my hormones caused by diabetes. And so I remember, there's another kid who probably wants to hear what I have to say at the end of the day. And I really just go back to wanting to help other individuals like me, connect with other individuals like me, and then also just be there for, for the younger ones who are trying to find their voice and really do feel like I don't think I can, fulfill my dreams when I'm a diabetic because it gets in the way of just everyday tasks. And that's what inspired me to also write my children's book. So that's my advice is just, thinking about who you can connect with and sharing your story. And even on the days you feel like you can't show up, you'll still have a community where you look at what they're doing and you feel inspired by it and happy. And, you're able to look at that and say, you know what, like I can fulfill what I want to, despite all of what diabetes brings to our lives.
Thank you, Lena. I think you touched on just such a great, point of advocacy just brings us such great community, and the fact that we, unfortunately we're brought this in our lives, but becoming involved just really brings a community you can lean on and learn from and become inspired by, even through the hardest points. And um, as a community, we've accomplished so much, and as leaning on one another, we really can make a big difference. And so I really appreciate you sharing your story, and about also your diagnosis with your childhood friend. That's what are the odds? But I'm so glad that you could, learn the power of community so quickly. So thank you so much for sharing. Um, I think before we move into Q&A, it looks like we have a question. This World Diabetes Month, and just, going into World Diabetes Day, which is officially tomorrow. Um, do you have any closing thoughts or anything that you would like people to know about what it's like to live with diabetes, or what you're celebrating this World Diabetes Day, or what your hope is or wish for the future? I would love to hear. You can choose one of those questions, or all of them, but we can start with you, Kay.
Well, as you can tell, I'm wearing my blue and white, my T1D shirt. And one thing I've been doing for World Diabetes Day or World Diabetes Year, uh, I've purchased the T1D Barbie. And there are 4 females in my extended family. We take in all comers, 4 young women who I've given them to and say, you are seen, you are heard. Just because you're a woman and you're carrying everything from to pick up FM radio and Radio Free Europe doesn't mean you're uh, you're able. You are I'm possible. You are seen. You are heard, and you are loved and accepted.
Okay. Thank you for sharing. That's so kind of you, and I'm sure they really appreciated you doing that for them. And it's so great to have, yeah, that representation, within Barbie. And so I know they appreciate that gift. So thanks so much for sharing. And now Lena, to you.
Yeah, so tomorrow on World Diabetes Day, I'm going to be donating 2 books to one of the local libraries that is in my neighborhood in Washington, D.C., just for, the younger kiddos who go and visit that library. And whether they're diabetic, or maybe it could be a diabetic's sibling or any kind of peer, they'll be able to look at the book that I wrote about, what type 1 diabetes is, and what a child with type 1 diabetes might go through, and learn from that.
Lena, thank you so much for sharing that. And thanks for, yeah, your generosity in doing that as well. I really think that's going to make a huge impact. And yeah, it's just pretty incredible that our community comes together and and does just such great things to impact others. And so, wow, thank you so much for sharing. That's really awesome for the both of you. I think with that, we can move into Q&A. It looks like we have a couple of questions. And so I'll go to this first one, and thanks for submitting them. How can those that don't live with type 1 or type 2 diabetes demonstrate support for loved ones and support diabetes policy? Kay, I'll go to you.
By not shaming, don't shame them and don't pity them. My mother raised 2 boys in the 60s and 70s. And the endocrinologist back then said, oh, you'll have to buy the special meals and you're going to have to do that. She goes, no, I got 8 kids. They eat what we eat. My mother was carb counting in the 60s. Do not make them feel less of a person. Do make sure they feel valued but make sure they feel loved and accepted, and and that their voice matters. I don't care if you're 2 years old or you're 70 years old. You have your story, and you need to tell it, and you need to be accepted.
Thank you, Kay. Yes, I agree with everything you said. And I think, a lot of times when we're faced with a diagnosis that can be extremely upsetting, that a lot of commentary around that is that, well, you're not going to be able to do this, this, and that. And I think that's
Mm-hmm.
actually quite the opposite. I think most type ones I know have done incredible things. And type 2 diabetic, everybody across the board is like, they've accomplished so, so much. And so I think, yeah, it's a testament to like what we're truly capable of achieving. And so thank you for sharing that, Kay. Lena, to you, how can those, who don't have type 1 or type 2 demonstrate support for loved ones or support diabetes policy?
Yeah, so one thing that had I've come across sometimes is, oh, well, at least it's not, another disability that's they'll name, or at least it's not that bad, and like downplaying it. So it's like, while we don't want your pity, we still want you to understand that like a hard um this is a hard disability that we have. It is hard to live with type 1 diabetes. It is hard to carb count. It is hard to have to deal with the pharmacies. It is hard to have to deal with these policies that change every day between, policymakers and PBMs and um, so on and so forth. And so just having empathy goes a long way. I feel like I try to be empathetic towards what anyone is going through. One person's heart is not the same as another individual's heart. And so just having empathy for what we go through, if a diabetic tells you, yeah, I just, I just had to switch insulin again, and maybe it's going to mess up my sleep. Just understanding that that is hard, and so that would be my advice. It's having empathy.
Thank you, Lena. I think, yeah. And, in general, I think empathy is so needed. And especially when it comes to, living with this. And, and in my opinion, it takes a village, to handle and thrive with this disease, right? And sometimes, yeah, we don't necessarily want to hold all the burden all the time. So just showing of empathy from strangers and, passerbys or friends and family and loved ones, I think is super important. So thank you for highlighting that. I think, at this point, we've kind of gone through our main event today, but I want to take the time to thank you both, Lena and Kay, for coming and serving as our panelists today, but also for everyone who joined us for this World Diabetes Day town hall and webinar. And as we've chatted about, we've made some really great progress in regards to the Inflation Reduction Act and Medicare negotiations, but there's still so much to do to lower prices for every patient living with type 1, type 2 diabetes, people who aren't on Medicare, and anybody who needs prescription drugs in general. Congress has a lot to consider as are going back into session. And so what we're going to ask for you all today is, to help us send our support and on the other side, block some of the provisions that they're considering. What we're asking is for Congress to pass Senate Bill 1041, which is the Bipartisan Affordable Prescriptions for Patients Act. And so this is going to touch a little bit about those patents, that patent reform we were talking about earlier. So this would close patent loopholes and stop the abuse that keeps prices high. So the information for that to get involved and to write to your legislator will be dropped in the chat. So it's accessible to you there. And then on the other side of that is to block the EPIC Act. And this is a bill that would undo parts of Medicare negotiation and give Big Pharma more power to raise prices unchecked. You'll find the links in the chat, like I said. So please take a minute, after this webinar concludes for World Diabetes Day to support our work on Patients for Affordable Drugs and also T1 International, to send a letter to your members of Congress and tell them to stand with us and not Big Pharma, and to put patients first as they should. This is how we keep the momentum going and make sure no one has to choose between insulin and rent or medication or groceries, because in the US, we shouldn't be having to choose between our livelihood and staying alive with this disease. So if, like me, you've left here very inspired, hearing from these advocates, I encourage you all to become involved with both of our organizations. Please visit patientsforaffordabledrugs.org and t1international.com to connect with us, or you can find us on any social media platforms. We'd be happy to plug you in and get you involved. T1I has many chapters across the country, and Patients for Affordable Drugs would love to hear your story. We really look forward to hearing from you all. Thank you all so, so much for being a part of this movement, and happy World Diabetes Day. Thank you so much.